7 Action News reporter Jennifer Ann Wilson live with what we just learned about the roadmap to reopening. Jen.
Yes, a lot of new details came out today during that press conference with Governor Whitmer. She said she's going to be monitoring the numbers very closely, but we did learn about the elements that will be evaluated, including the types of employees and the different types of roles within a company's particular setting. They said they will be evaluating just how often and how closely employees interact with each other, how often and closely they interact with the public, and the environment of the workplace. Those are just some of the elements that will be evaluated.
None of us wants to see a second wave, and we can't risk that from happening.
As the number of new cases continue to decline daily here in Michigan today, 432 new confirmed cases announced. That's about a third of the new daily cases just a week ago. Governor Whitmer also highlighting progress in programs for small businesses and relief for those unemployed. She also says there's an expansion of free health care services to include mental health. The big news of the day, Whitmer introducing her My Safe Start plan, a plan to re-engage businesses and get Michiganders back to work. She says there will not be specific deadlines. Instead, this plan will be implemented while monitoring public health and measuring successes every step of the way.
Additional outdoor enterprises that we feel pose low risk. We'll also be looking at residential and commercial construction. That industry, for example, will be one of the first sectors to return to work.
Well, Governor Whitmer described the process of re-engaging as a dial, not a switch. She says they will be monitoring the data very, very closely. She also said that the state will be divided into 8 regions, and that each of those 8 regions will be assessed based upon what's happening there. And there are 3 elements within that assessment. First, the success in flattening the curve in that particular region, the ability to diagnose and treat patients, and the ability to track and isolate contacts with confirmed cases. There are more details that she was able to release, but the overall message here was that she will continually reevaluate the data and make changes as the data allows. And she says that if those numbers of confirmed cases continue to rise, she will have to roll back. Reporting live, I'm Jennifer Ann Wilson, 7 Action News.
A lot of work to be done. Jennifer Ann, thank you.